For the second question, let's shift gears a little bit and hear about a plant that you found yourself using quite a lot lately, especially if it's something that's changed over time. Maybe it's something that you didn't used to use a lot and now you do. Why is that? Why do you think that this plant is used often? Why do you like to use it? How do you like to use it? Tell us a little bit about a favorite plant of yours.
Okay, this was a really hard one to answer because it was challenging to pick one. And I've decided to go with hawthorn leaf and flower. This is something I work with quite a lot in many of my formulas, especially for my folks who are trying to get pregnant. This is not something that featured predominantly in my practice when I was first getting started. When I was starting out, I really was sticking within the bounds of what I was taught and thinking like, oh, okay, fertility, we're going to work with the menstrual cycle and we're going to use our, our dong quai if somebody's not actively trying to get pregnant right now, and our, this, that, and the other, the Vitex and so forth and so on, and really focus on hormones and all of this. And while I still do that to a certain degree now, I have come to realize over the years, and I knew this academically, but I think just seeing it in practice has helped me understand it on a different level, that when we're working around fertility, we really are working with full body health. And so a lot of times, most of the time, I would say that when somebody's having a menstrual cycle disruption or fertility challenges, that it may or may not be related to the hormones. It may or may not be related to, estrogen and progesterone and anything else that's going on. More often than not, we need to look at some other things that are blocking health in the body, such as sleep and the nervous system or digestive function or any number of other things that might be going on for people. So a lot of times when I'm working with folks, you might look at their formula as a trained herbalist and be like, you would not guess that our focus was fertility. So a lot of times it's really more full body constitutional support that we are doing for a long time before we ever get into anything specific related to, quote, the menstrual cycle. Although many times it's shocking sometimes how much change you can affect in the menstrual cycle when you just support the nervous system or when you do constitutional support, etc. So why am I blabbering on about this and what does it have to do with hawthorn? The reason it has to do with hawthorn is because hawthorn, especially the leaf and flower, are so supportive for the blood vessels. And a quick physiology tidbit, because I can't help myself. We oftentimes think of the blood vessels as tubes, like a pipe to get water from one place to another or something like that. So we think about it sort of like moving the blood around the body. And yes, to a certain extent, the blood vessels are doing that. But unlike pipes, they are responsive to what's happening both in the blood and in the tissue that they're flowing through. And so these blood vessels are constantly changing. They're constantly responding, and they're constantly, things are shifting around in the blood vessels. They're dilating and contracting. There are different things going on in order to control the flow of blood and so forth. So anytime we want to do any kind of healing, we need to think about the circulation, right? Because in order to do healing in any tissue, we need the blood to bring oxygen and other nutrients for the possibility of healing. And then we also need to remove waste. So the blood vessels are absolutely critical for any type of restorative or healing work. And many times the blood vessels are struggling a lot. One of the things we know about the blood vessels is that they actually have a thin layer. Many of the blood vessels have this thin layer on the inside of the vessel called the glycocalyx, which is just a series of proteins and carbohydrate chains that basically flow with the blood. So they're attached to the endothelium or the lining of the blood vessel, and they are moving with the flow of the blood and helping the blood vessels sense what's going on. So when you have, constriction of the blood, when you have lots of sodium or lots of sugar, that can influence the glycocalyx, which then helps the endothelium say, okay, should we contract? Should we dilate? Do we need to bring sugar and sodium out of the blood? Do we need to move some of it back in, and so forth? And the glycocalyx, we never knew about this before because it's hard to study. It's only really present when the tissue is living and doing what it's doing. And so you can't really do an autopsy and be like, wow, look at all this glycocalyx. So it's a really challenging portion of the body to study, but we do know it's there. And there's actually some evidence. It's not the strongest evidence ever, but there's at least some evidence that hawthorn leaf and flower can support the glycocalyx. So I love thinking about how can we use hawthorn? How can we work with hawthorn in folks where we have reason to suspect that their blood vessels are having a challenging time? So folks who are having hypertension, any kind of underlying kind of cardiometabolic stuff going on, I really like to work with hawthorn, especially as it relates to fertility, but also people who seem to struggle with blood sugar. So anybody with kind of metabolic syndrome types of things going on, type 1 or type 2 diabetes, I'm really thinking about their blood vessels and how can we make sure that these variations in sugar and glucose, the blood glucose, are not adversely affecting or minimizing the adverse effect on the blood vessels. Of course, hawthorn, the leaf and flower, also have really lovely, gentle nervous system effects. They're working in so many ways that we probably don't fully understand. But I really find that it's such a beautiful, supportive herb that can make a difference for people. And it's an herb that I consider to be relatively safe in folks who are trying to get pregnant, in pregnancy, and in a number of different types of people. So I work with it quite a lot, and even better, it seems to be well tolerated. People don't mind the taste, typically speaking. So this is an herb that I find that it's a big one that I use often, and maybe it's not the first thing that would come to mind for people when you think about fertility and the menstrual cycle.